Happy Friday. This is Andrew from Insight Rehab for our Insight of the Week. And today we are talking about trigger points. So trigger points, or as you might call them more commonly, knots, are spots and muscles that are particularly sore, okay? You might find them up in your traps, you might find them in your legs. They kind of can be all over the place. Any muscle can kind of get them. What are they and what do you do about them? So what are they? Are there spots in the muscle where the muscle has tightened up? And what we find is when we look at these things more deeply with imaging is that the muscle actually has spots where they don't have as good of blood flow. And for you, they'll feel like a bit of a lump or, again, like a knot in that muscle, okay? And so when you get these, they can be painful. They can hold you back from doing things. And what do you want to do about them? Well, there's a lot of different modalities that you can use, that we can use to help get rid of those, okay? So some of the things that are more common are going to be things like trigger point releases, so like a massage of some sort of therapeutic massage, all of that type of stuff. You might see people use things like a Theragun, some sort of device like that. Those can help alleviate knots. There are lots of different options, but universally what you're doing there is you're getting to that point in the muscle and you're trying to increase blood flow and get that muscle to open up and relax that knot. So one of my favorite versions of things to do for these knots is something called trigger point dry needling. So I'm going to demonstrate that today. I just want to give fair warning, guys. This is only be done by trained professionals, so please don't try to do this one at home. This is Diane. This is one of our more common presentations for trigger points or knots, and Diane works out pretty regularly, but she also is an office worker during the day. You may recognize her. So one of the things Diane tends to get is trigger points or knots up in the upper part of her trapezius muscle. And that's a very common presentation. We see this one a lot. And so today I'm going to demonstrate a trigger point release method, again with a dry needling, to release those knots in her upper traps. And again, one last time, not for doing it at home. This is just for trained professionals. All right, folks, so Diane is prepped. She's ready to go for some dry needling. Again, dry needling is done by trained professionals. Notice I'm wearing gloves. This is a process that requires extreme cleanliness. So I'm going to take this needle. It's a dry needle. It's just like a little acupuncture needle, okay? You can see that right there, okay? So I'm going to take that needle, okay? And I'm going to get into her trap and little pinch Diane. We're going to give it a little bit of a push into the muscle. She may feel a little pain, but it shouldn't hurt too bad. Good. How's that feel, Diane? You doing okay?
Yeah, it's fine.
Good. And I'm going to pull that needle out. Okay. Little rub there. Okay, so that's dry needling. How did that feel?
It was good.
It was good. The muscle is a little bit more released. That knot is released, and so that should help her feel better. That's our Insight of the Week.